Okay, good afternoon, everybody. I'll again start with our public health hero. Today I want to recognize LaDonna Reinert. She is the administrator for the Lincoln County Health Department. LaDonna is known for her calm presence during storms, including a pandemic storm, and for her very strong leadership. Under her direction, the county has achieved a huge milestone. They have all of their teachers and school staff having received their first dose of the COVID-19 vaccine. So congratulations to LaDonna and to the Lincoln County Health Department. Now the numbers. Since Monday, Kansas has reported 1,122 new cases and 81 new deaths. This brings us to a total of 292,837 cases, 9,189 hospitalizations, and 4,724 deaths. So my administration is continuing to move forward with our COVID-19 response, particularly in the area of vaccine distribution. To just give you a brief idea of what we're up to, our efforts to vaccinate teachers and school staff moving along very well. We hope to have every teacher across the state fully vaccinated in the next couple of weeks with their first dose and shortly thereafter with their second doses. We're working closely with local providers to fix the ongoing data reporting issues. We should see a significant difference in reported administration rate of the vaccine very soon. My administration and KDHE are working with Kansas's communities of color to set up culturally relevant outreach to ensure equal access to both information and vaccinations. We continue to pay close attention to the balance of vaccine distribution going to our urban areas and our rural areas, and we're modifying our vaccine distribution plan to ensure counties receive doses proportionate to their size. We've also received some good news on the vaccine front. An analysis by the Food and Drug Administration showed that the Johnson & Johnson vaccine provides strong protection against severe illness and death from COVID-19. And what makes the Johnson & Johnson vaccine different is that it only requires one dose and is much easier to store. Given that it doesn't require a second dose, Johnson & Johnson can be deployed more efficiently and open up opportunities to vaccinate a wider swath of the public. The Federal Drug Administration could authorize this vaccine as early as Saturday, and Kansas could start receiving doses as early as next week. Also good news, the number of other vaccine doses coming to Kansas is steadily increasing. Next week, Kansas is expected to receive approximately 120,000 Moderna and Pfizer doses. That's a jump up from last week's 115,000. Additional shipments over and above the 120,000 are coming into pharmacies and some of our safety net clinics across the state. That's why today I've issued an executive order to ensure we have enough vaccinators to vaccinate more Kansans quickly. The order makes it clear that pharmacy students, dentists, paramedics, and other healthcare professionals are authorized to vaccinate Kansans with the COVID-19 vaccine. Professionals in these areas routinely administer injections. We just want to make it clear that the authority extends to administering the COVID-19 vaccine. So after a long and challenging year, we all feel optimistic as vaccine allocations climb and case numbers continue to trend downward. But we also must continue to think about the pandemic's long-term implications. Over the past year, my administration has addressed the immediate challenges of COVID-19 while still planning for the future. We need in place guardrails that will protect Kansas families, our schools, and our businesses should we ever be confronted with a challenge of this magnitude again. One of the most obvious avenues we're pursuing, and one that you all know I'm pretty passionate about, is Medicaid expansion. This morning, Representative Brandon Woodard introduced legislation to expand Medicaid in Kansas and give 165,000 Kansans access to affordable health care. I have repeated time and time again, that Medicaid expansion is a no-brainer. In addition to expanding coverage, it injects billions of dollars into our local economies, it creates jobs, and it protects our hospitals. The bill also establishes a regulatory framework to make Kansas the 48th state to legalize medical marijuana. By combining broadly popular, common sense medical marijuana policy that will generate significant revenue with Medicaid expansion, all logical opposition to expansion is eliminated. This bill just makes sense. In the face of the worst public health crisis our country has seen in a century, I'm even more committed to delivering health care and jobs and support for our hospitals through Medicaid expansion. I urge the legislature to take Representative Woodard's proposal seriously and to also consider the implications if they should fail to pass expansion yet again. Billions of taxpayer dollars, Kansas taxpayer dollars, will continue to go to other states to take care of their citizens, their hospitals, and their economy. And with that, I'll take questions.
Governor, in addition to considering various things, the legislature is working on a speedy trial bill to suspend those deadlines for 3 years. What do you think of that? And then second of all, Senate Republicans have unveiled their emergency management law going forward. And if you wanted to issue an executive order, you'd have to give it to the Attorney General in 24 hours in advance and then get a legislative.
Yeah, I know the details.
You know the details?
Yeah, I do.
You love them, right?
Very enthusiastic. Well, your first question was about the speedy trial.
Right, what do you think?
You know, clearly we've got to do something. You know, we have a huge backlog on trials all across the state. And, you know, we've got laws on the books that would really make the state very liable if we're not able to perform those within the specified timeframes that are in statute, but have been suspended during the pandemic. It's clear that with that backlog, it would be very, very difficult for our courts to meet those deadlines. And so I think it's wise on the part of the legislature to allow them to extend the deadlines on those, recognizing that I have every confidence that our court system is very anxious to continue to provide due process in as expedited a time as possible. So I'm good with it.
And the Republicans' plan, I sensed your stated enthusiasm was a little sarcastic there.
And what was that about?
The part about executive orders, and there's also some limits on public health.
You know, there is a good reason that you ask for an emergency declaration because you have an emergency. Generally, emergencies requires rapid response to the issues presented. So I think any impediments that are put up to being able to rapidly respond to crises is a very bad idea.
Does your administration have your own version of a bill like that you would like to see adopted?
On the KEMA, on the
Yes.
Emergency Management Act,
Yes.
we don't have our own bill drafted, but we have been in regular communication with the legislature, so they know, that we've just been working with them to come up with a reasonable, thoughtful bill that addresses, what are some legitimate issues, given that the Emergency Management Act, I think, was formulated, in the 70s? And the pandemic is very different than any emergency we have seen. So, yeah, the Emergency Management Act probably needs some modifications. We've been working with them to come up with the reasonable modifications that we need that would make things work better.
Another part of the bill, I believe, is giving citizens a lot more petition or file a lawsuit if they feel they've been aggrieved by a state or local order. I mean, is there concern that could rack up the legal costs pretty quickly?
Yeah.
Imagining all the businesses that were closed and March suddenly descending on the Shawnee County Courthouse.
Yeah, I don't know the details on that, Andrew, on exactly what rights it gives, but people have a right to sue all the time. Yeah, that's just the way that it is. It's just finding an attorney who'll take the case.
there's a new vaccine reporting practice that supposedly went in place this week with a snapshot. Maybe Secretary Norman can talk about it more. Are we seeing higher numbers of actually vaccines getting into arms with this new practice? Are numbers changing yet and going higher so we're not in less places?
Yeah, I believe the answer is yes. That we've gone from 200,000 unaccounted for doses to closer to 100,000. So that clearly means that the reporting is better, because it was our belief before that the 200,000 was not accurate. So it's getting more accurate. But let me give you over to Dr. Norman to give you any more details that he's got.
Thank you, Governor. The answer is yes. We now have over 80% of the doses that have been distributed are in the system as having been administered. And it's been gradually increasing. It started weeks ago in the 40 to 50%. It's going up every day. And we know that that is still underrepresenting the doses that are truly given. Keep in mind, we're only on day 3 of a 3-part fix, if you will. One is a daily snapshot that we find out from every vaccinating site every day how much they have in inventory, because the question really is how much is in inventory, and then if the doses have been administered but not showing up as having been administered in our WebIZ system, what is the HL7 interface issue? So what we're doing as part of this, also part 2 if you will, is fixing the interface. But to do that, we have to do a diagnostic to find out where that is, and that's what point number 1 will answer. Third thing is that there's patient-level information of those who have been immunized that are not yet recorded. The vaccinating sites will send us a flat file, a spreadsheet, so that we can account for and play catch-up. So those are the 3 points.
Dr. Norman, I have a question for you. Speaking of vaccines, there's a bill that's going to get a hearing in the Senate tomorrow that prevents employers from taking punitive action for if they stopping. Oh, go ahead.
Yeah, that's a political question.
Okay, you can take it. Anyway, there is a bill that would prevent employers from basically mandating vaccines if they choose to go that route. What's your thoughts about that?
Brad, my thought on that bill is that it is a solution in search of a problem. There have been no accounts of employers forcing folks. If anything, I think they've been incredibly flexible and recognizing that some people may choose not to, and they're accommodating that. So I don't think it's necessary. It's probably they need to be focused on some other things that actually make a difference.
Governor, we have a question for Dr. Norman. Clarification on yesterday's KU phone call in the morning about groups who are individuals who are 70 years and older. We've heard from dozens and dozens of their loved ones and then themselves saying that they can't secure vaccine appointments. Yesterday on the call, you said they should be vaccinated at this point. What is your advice to them?
Yeah, great question. Why aren't all 70-year-olds and older fully immunized at this moment in time, given that there's more vaccine coming in? And the short answer, of course, is there's still not enough vaccine coming in. As you know, phase 2 is a very large number of people, right at 1 million Kansans in phase 2, and especially with, if you will, having teachers and some other categories of people in phase 2, there are still, unfortunately, 70-year-olds and older that are home, particularly single or couples at home that have a hard time either navigating the internet or making those arrangements. I still believe that there's enough vaccine, depending on how the counties choose to allocate that. And we, as you know, defer to the counties in large measure in terms of, as long as they're staying within the prescribed phase, that they can run their affairs of their county in that manner. Because they're all in phase 2 for different risk reasons, and it's a matter of judgment as to which are the groups that go next.
Last question. Governor, the U.S. House is moving towards voting on the next stimulus package, which could mean $1.6 billion for Kansas. Where do you think that money should be spent on the biggest needs in the state?
Well, I think some of that money is clearly designated for certain areas, that we'll need to spend it within that framework. So, you know, I never count my chickens before they hatch, so I have not made a laundry list of things that we're going to spend it on. But I can tell you that, you know, I am fully cognizant that while it is a lot of money, we need to remember that it is one-time money and not start developing programs that are going to require ongoing sustaining. We need to look at those kinds of things where we can make a real difference with one-time expenditures, whether that is paying down debt, that's investing in infrastructure, you know, backfilling, you know, some of our budgets that have been pretty decimated over time. But you know, so we'll be looking at those kinds of things, but we have not selected anything. But just generally, I'm going to be looking for one-time expenditures that will leave us better, you know, give us something to show for our money, or get us out of debt.
Thank you.
Do you have any comment on this audit that suggests that the fraud might, you know, unemployment might be 600 billion instead of 290?
You know, I realize that there is a, you know, ×2 difference between what the Department of Labor's numbers show, which I think is what, 290 million. You know, some of that the state fund, some of that the federal, and that the post audit was what, up to 600 million. You know, all I can tell you is that, you know, we based our numbers on data that we have. You know, that we have some detection methods that we can scope out what's fraud, what's not. We also have a backup system with the 1099. So if somebody gets a 1099 that suggests that they got this payout, there's a process where they can call, and that will alert us to another fraud. So we've got all of that in place, but I understand that, you know, we, you know, some might say we're just saying that because it makes us sound better than post audit. So what I've done is order an external audit so that somebody outside the Department of Labor will take a look at those figures and come up with an independent approach.
Thank you.
Who is this external audit, and when was it ordered? I mean, this is, you said you've actually taken the steps.
We are going to do that, and we can have our Department of Administration go into the agency.
This is news to me. I mean, I guess, what's the time frame on that?
Well, as soon as we can get to it. You know, we know, you know, with the post audit being out there at this point, that there are questions that people have. We want to answer those questions. So we will have this external audit that will give you the answers.
Thank you.